we're talking about the global burden of stroke and how many people are sort of affected by it. What are your thoughts, Weihai? How are we doing in terms of global incidence and prevalence of stroke?
Yes, I think in China, ischemic stroke is the leading cause of death. And there are about 2 million new stroke cases in China every year. So I think it is a very large burden for this country, for the Chinese families. I think compared with Western countries, we have more stroke population. So I think it's very challenging for Chinese neurologists.
Okay, thank you. So before I ask to Professor Song, so I need to introduce a worldwide stroke data beforehand. So sorry about that. So the stroke is the second leading cause of death and a third leading cause of death and disability combined. And for Asian people, stroke is the biggest problem, I think. And approximately 9 out of 15 million people who have stroke worldwide are Asians. So as life expectancy increases due to aging and reduced infectious disease mortality, and the prevalence of vascular risk factors increases among economies in transition, the stroke burden in Asia will surely rise. So in China, as you say, so the stroke incidence is getting worse year by year. Is this correct?
Yes, and in China, that we have the data show that every year the stroke new onset stroke may be increased 0.87 per year, and at this time they haven't get the top, get the top. So we think we have a lot of way to do to reduce the increase the onset.
Yeah.
Okay. Thank you. So the second part, I will talk about the Japan situation. And in Japan, the stroke was the leading cause of death in mid 60s. However, nowadays, stroke is the fourth leading cause of death in Japan. The top one was the malignancy, followed by cardiac disease, and the third is the senility, so old age just leads, and the fourth was the cerebrovascular disease. As the rate of death is declined over time, however, the disability person are very frequent in Japan still. So we need to convey the burden of stroke in Japan as well. And the main cause of stroke is ischemic stroke rather than hemorrhagic stroke. The reason for declining the death rate is because of the hypertension control and the resulting in the prevalence, low prevalence of the brain hemorrhage. So the situation is very changing nowadays, and still we have a problem to convey the stroke burden. So we need to concentrate on various risk factors and modification to have a better life expectancy. So this is the Japanese situation. So the third part will be the South Korean situation. I would like to ask the Professor Kim.
Thank you, Dr. Hirano. I think the situation in Korea is very similar with the other Asian countries. Well, the cause of death, stroke is in the fourth position of the cause of death. Well, the first one is cancer, the second one is cardiovascular disease, and the third one is pneumonia, and the fourth is cerebrovascular disease. Actually, the stroke was the third cause of deaths in Korea, but a few years ago, pneumonia have increased it, and now pneumonia is much more of higher rate than stroke for the cause of death. But still, though the patients do not die with a stroke, they may have a neurological deficit for their lifelong period. So I think still stroke is a very important disease which can cause neurological deficit in their residual life. Also looking at the etiology of stroke, well, in the 1950 or 60, about half of the stroke was hemorrhagic stroke because uncontrolled of hypertension or other uncontrolled risk factors. But nowadays, more than 90% of the stroke is caused by ischemic stroke. And as ischemic stroke is also preventable by reducing and controlling the risk factors, I think we still have to control more risk factors, especially like such as hyperlipidemia or dyslipidemia.
Okay, thank you. The Korean situation is very similar to our Japanese situation. How about in China? How is the etiology in China?
It seems as in our neighbors in your countries that hemorrhage stroke has reduced during the hypertension control. But in China, a lot of patients take the medicine to hypertension, anti-hypertension, but um, most of them they haven't get the target of the blood pressure. So not high as ever, but even higher than standard. So they have less hemorrhage, but higher ischemia stroke.
So I think we're facing this similar, we're facing a similar sort of an issue here in Australia. The thing, however, is that when you look at the global numbers, they always talk about how the overall numbers of stroke in developed economies seems to be coming down slightly. The number of survivors, however, seems to be growing. But I guess the important thing to remember is that the global burden of stroke is especially true in low income and middle income countries. And I think that's something that needs to be sort of looked at. So while developing countries might be doing fairly okay, it's the low and middle income countries that we need to worry about in terms of the global prevalence of stroke.